Good morning. We are here this morning to give our latest update on the coronavirus in Kentucky. As you all know, the information changes very quickly, and our goal is to lead with information and to provide as many updates as are required, oftentimes even if we have to, several in a day. As of this morning, we have 6 confirmed cases of the coronavirus in Kentucky, but that number is expected to grow. We expect to see more cases. We are prepared to see more cases. So I hope folks out there know that just because our numbers will grow, and they will, again, stay calm, no reason to panic. We are all going to get through this. I'm working all day, every day, on making sure that we are fully prepared for any contingency. I can tell you that your state government and your local governments, your local health departments are doing a great job and doing everything we can to be prepared no matter what this throws at us. All 6 individuals is 3 individuals in Harrisville, 2 in Fayette, may provide today, ensure that they gather the data. There are also some privacy laws that prevent certain types. Should remain calm, and the number one thing, Eugene, is the best way to prevent contracting the coronavirus. It's also the best thing you can do not to spread it. As doctors are going to show little to no symptoms, and so it's important in your hygiene to make sure that we are not transmitting the coronavirus to others. Also, we have some guidance out there. I'll talk every day. We are taking more and more steps to address the state of emergency, which gives state government evaded or costs associated with getting care or testing for the other costs for most private insurers that we have the power to do so with. We have guidance on and particularly counties with positive cases, at least 3 about symptoms and when someone should seek medical attention for communities that the corona is important for those that are well but nervous, or those that if the coronavirus was out there, may be sick but otherwise wouldn't be seeking medical attention, but for the fear that might go along with the coronavirus. The when to seek care guidance that's on the website we believe is critically important. It both puts people's symptoms as massive harm, is in facilities with our seniors, especially fragile seniors. And we're going to recommend some stronger guidance today on that. And I understand that there are Kentuckians out there who worry that they might not be able to see their loved one. I get that. But right now, we are making sure that we are protecting the life, health, and safety of individuals in that facility. So we may reach a point where it is very difficult to see a loved one in those facilities, and I understand the individual emotions and pain that may come along with that, but we are doing everything we can to protect that loved one. And I hope people will stop and think, given that they could have this and not be showing symptoms, what it would mean if they were the individual because of wanting that visit that spread the coronavirus throughout one of these facilities. We've asked businesses to prepare telework options and adopt paid sick leave. We're instituting paid sick leave for state employees to ensure that everyone has enough time if they are showing symptoms of the coronavirus. Today, we are taking really 2 additional steps this morning, and we may have more this afternoon. First, I'm signing an executive order that allows pharmacists to refill prescriptions up to 30 days. That especially helps our homebound seniors that might not be able to get to a doctor to get that prescription refilled. It also will temporarily allow people to operate a pharmacy in an area not designated on the pharmacy permit. So if we reach a point where we have to set up mobile stations to help people, that tool is already going to be in effect. It allows pharmacies to dispense drugs as needed to create COVID-19 according to any protocols established by the CDC, the National Institute of Health, or by the Commissioner of Public Health to respond to this emergency. The second piece today is stronger guidance on restrictions in our nursing homes, our long-term care facilities, any facility that has seniors that, as we have seen, are highly susceptible or have outcomes that we want to absolutely avoid here in Kentucky. For those that have questions and concerns, if there is an inability to reach a loved one or want to know a little bit more on how these are coming together, you can call the Inspector General's office. That number is 502-564-2888. It's important. If somebody wants to talk about visitation in one of these facilities, they don't call the overall coronavirus hotline. That is for folks that are worried about complications, talking to medical professionals. So any questions about visitation that you want to direct to state government needs to go to the Inspector General's office at 502-564-2888. Kentuckians should have confidence that we are working every day to protect them. And that's why you hear about more and additional steps every day. We want to make sure we do everything we can that is reasonable, that is based on the science, to ensure that this doesn't further spread and that we can contain it, given that we now believe that this is a community spread virus. Finally, it's always important to put this into context because with the huge amount of coverage that's out there, it can cause real concern amongst our families. The flu in Kentucky, as we're here right now, we have 22,591 confirmed cases. That's compared to 6 confirmed cases of the coronavirus. Now, we will have more of the coronavirus, but putting that in context of what we're seeing with the flu, we've had 85 deaths as of today with the flu, including 4 children. So with both of those, please, Kentuckians, practice the type of hygiene that protects everyone around you. Wash your hands with soap and water for at least 20 seconds. If you don't have that, use a sanitizer, but soap and water is better. It's not just as good. So if you're concerned about not being able to find sanitizer in places, just wash your hands a whole lot more. If you are sick, stay home from work. And if your child is sick, they should stay home from school. We are continuing to plan for every contingency, and that includes if the need arises for more school closures. While I don't think we are there yet, remember we have done this for the flu. Our superintendents have systems in place, so we ought to just understand as we move forward, there may have to be additional steps. So with us today are a number of folks that are going to talk about efforts that they are taking. What you'll see is whether this is government, our associations, private healthcare providers, we are all in this together. We are all working together, and we are going to come out of this on the other side. Kentucky, we're going to be okay. I know people are going to be nervous, but we are going to be okay. It's going to take every single one of us practicing the type of hygiene that we need to practice to get to the other side of this, but we will get to the other side of this. And if we've adopted the practices that help us get there faster, we may be better off in the next flu season and better prepared. So a number of folks that are up here today. I'm going to first introduce Betsy Johnson from the Kentucky Association of Healthcare Facilities. Betsy?
Thank you, Governor. My name is Betsy Johnson. I'm the president of the Kentucky Association of Healthcare Facilities. I just want to thank Governor Beshear and his leadership, Dr. Stack, Adam Mather with the Office of Inspector General, and we look forward to continued collaboration. Thank you.
We also have Nancy Galvani, and I know I mispronounced that, my apologies, from the Kentucky Hospital Association. Gail Vani.
Galvani.
Gail
Very
Vani.
good. Thank you. Thank you, Governor.
Galvani.
And again, we also want to thank all the people at the state. We've been in very close communication with our partners at the state, Department for Public Health in particular, and all of our hospitals work very diligently to plan for disasters and emergencies, and so we are well prepared. Our staff, we have dedicated staff at our association in emergency preparedness and infection prevention. We've been fielding calls with our members for quite some time as the coronavirus has been evolving and spreading, and we've posted a number of resources on our website. We do have a public website, so people can go out there. We have information for our healthcare leaders, our clinicians, and the public as well. We've been pulling down information from the federal guidance, the Department for Public Health, and trying to distill what our hospitals really need to know, and have been sending out very detailed communications to our hospitals around a number of things, around personal protective equipment, signage for the hospital, isolation protections, infection prevention practices, all sorts of information is out there. In addition, we are coordinating very closely with the Kentucky Department for Public Health, really on a daily basis, to make sure that our people have the most up-to-date information. And so I just want to assure everyone that our hospitals are preparing for this, and they are ready to provide quality care to their patients. Thank you.
Thank you.
Do we have Eleanor today?
No. Okay, next, we have Tim? Yep. Next is Tim Vino. He is from Leading Age Kentucky. Tim?
Thank you, Governor.
Thank you.
Thank you all. I want to also thank the Governor and Secretary Friedlander for their excellent communication and coordination. We all are working together. We take this emerging threat very seriously and are taking the necessary precautions, including restricting visitation, advising our employees not to come to work if you're ill, being flexible with our leave time. Now, we are used to dealing with emerging threats, seasonal viruses, influenza A, norovirus, and we are well equipped to deal with this emerging threat. And we look forward to continuing the cooperation with the Cabinet as we go forward. We believe that it's a very prudent step to restrict visitation, given the fact that we know very little about this particular virus and its impact on the public. Thank you.
Thank you. Next, we have Dr. Brent Wright, who is the head of the Kentucky Medical Association. Thank you. Right. Thank you.
Good morning. Thank you, Governor Beshear, Secretary Friedlander, Commissioner Stack. I'm Dr. Brent Wright, President of the Kentucky Medical Association. Kentucky physicians stand on the front lines of facing the coronavirus threat. However, we will not achieve success unless we cooperate fully with our team members throughout Kentucky and those who see here today. The Kentucky Medical Association is working in collaboration with the excellent efforts of the administration, the Cabinet, and Office of Public Health to make sure we deliver clear and concise information to our physicians, the patients they serve, and the public at large. Now is not a time to panic or promote fear. Now is the time to join together in an effort to protect ourselves, our communities, and our state so that we achieve a successful outcome in addressing the COVID-19 virus. Thank you.
Thank you, Dr. Wright. Next, we have Bob White from the Kentucky Senior Living Association. Okay. Next, we have Secretary Eric Freelander from the Cabinet for Health and Family Services.
Thank you, Governor. Thank you, Commissioner Stack. I think this is the times I've addressed you all. I've tried to say we have a process in place. We have procedures in place. We have personnel in place to address this issue, and this is not the first time we've tried to address these types of issues. The Cabinet for Health and Family Services, not only do we have the most excellent Commissioner of Public Health, we also have our Inspector General, who goes and actually surveys all the facilities across Kentucky and works with these associations you see up here. We have our Department of Behavioral Health. Dr. Alan Brenzel is here. We have the Department for Aging and Independent Living and Department for Medicaid Services. You've heard some of the things that we're doing in all these different departments. But today, what I want to talk about first is to be thankful for all of these things, as well as everyone's who is up here, to show that we are all working together to address these issues as they present. So part of what we're announcing today is that we are restricting visitors to our long-term care facilities. And that includes the ones with the Cabinet for Health and Family Services, our intermediate care facilities, our nursing facilities. We are asking people not to visit. If it's an end-of-life situation, obviously that's different. But we are asking our facilities to make sure that they are sure of their infection control procedures, make sure that they are confident in their emergency procedures. As you heard folks here discuss, that our hospitals have pieces in place that will allow them to separate those folks who have respiratory issues from the rest of their population. And we've received some guidance from CMS to allow us to do that. So we're in constant contact with both our federal partners and our state partners and our local partners, because that's how we address these issues together. It's what we do as a state. If you have concerns, and as the governor said, this is a very difficult decision for us to make, but it is the right decision to make. This is one that protects those people who are in our long-term care facilities. It is important that we do this. So with this, we're asking people's patience. You heard about the Office of Inspector General's phone number. We have the long-term care ombudsman who we work with, who actually go into all the facilities and talk with residents to make sure that they are being treated well. So know that that is our main goal. We want to assure people across Kentucky, we know this is a hardship. But this is something that we're doing to protect the health and well-being of all our Kentuckians, particularly those, as we heard from the CDC guidance, particularly those that are older and may have some chronic conditions. That's who's in our facilities. So we need to be very careful about how we interact with those folks. So employee screening, infection control procedures, when we go out and inspect, you all, just so you know, we'll be looking for that. So those are the kinds of things that, working together as a team, I believe we will address this issue head on and make sure that we are as effective as we can as we begin those mitigation efforts. Thank you.
Thank you. And last, we'll hear from Dr. Stephen Stack, who heads our Department of Public Health. I want to again mention how hard the individuals in that department are working. I'm not sure they've slept now in about 4 days, but they are doing an incredible job going above and beyond, and I am so appreciative of their work and Steve's.
Thank you, Governor. I want to thank all the others who've given you important information today. I'd just like to emphasize, please go to our website and please go there regularly. We update it multiple times a day, so kycovid19.ky.gov, kycovid19.ky.gov. I want to emphasize that because we're trying to put up timely and accurate information, and that's the best place to go for Kentucky-specific guidance. So the information about recommendations for visitation to long-term care facilities and the like will be up there today. So if people want to see that guidance, it's available to the public as well as the interested communities. There are other guidance documents that will be posted there, and so please go there regularly. That is the most reliable place to get the most current advice we can push out to the public. And again, please, I know this is scary for folks. It's okay to be concerned, but it's not okay to panic. We're going to get through this, and the governor's given you statistics about putting this in context relative to influenza. Well, they're not the same. I'm confident that as a state and as a nation, we're going to rise to the challenge. And I want you to know there's a lot of people hard at work on your behalf. And for those things we ask you to do, like personal hygiene or restrict visitation, I want you to hear a very personal thank you for your compliance with those as we work to keep people safe. And in closing, thank you to Governor Beshear. These are challenging times when you're trying to balance the needs of society and what we can do as public health, and I couldn't have asked for a better governor to work with, and I'm very grateful for his inclusion of me in the decisions we're making. So thank you.
Yeah, thank you. So our message today is while we are taking some additional steps and while we expect more cases, that everybody should stay calm, should understand that there's going to be some disruption to their daily lives, but we've got to be our brother and sister's keeper, which means that we don't just protect ourselves from getting this, we do what's necessary to keep us from spreading it to other folks. We believe by taking these firm steps that we can protect those who are the most vulnerable. Let me close by thanking the media for your help in getting out the word, especially when it comes to hygiene and the things that people can do to ensure they don't spread it and they don't get it. I also appreciate the responsibility we have seen because facts and context matter significantly when you're dealing with something that scares people. And I just remind everybody that one misworded tweet or Facebook post or the rest can cause a lot of concern and or panic that we don't need out there. Panic and fear, again, can cause significantly more harm to our people than this virus is going to. We will get through this. We'll get through it together. We'll come out the other side. So with that, we'll take any questions.
The ages, and can you go through that list again?
Yes. Our 3 individuals in Harrison County include a 27-year-old female, a 67-year-old female, and a 68-year-old male. In Fayette County, there is a 49 and a 46-year-old male, and in Jefferson County, it is a 69-year-old male.
Okay, and then are there any more tests out this morning, or they're doing?
We'll have tests every single day. We don't know until noon exactly how many we will test in a day. If we have positive results, you will see us this afternoon.
Dr. Friedlander, maybe this is a question for you or Governor. These restrictions on visiting at long-term facilities, is this a state order or is this up to the individual facilities to determine if they follow these restrictions?
Well, we are for facilities that we run or are a part of. This is going to happen. These are our steps we are putting in place. And then we are issuing very strong guidance, which is at the moment what we are able to do that we believe that these facilities will follow. It is critically important that it is followed. When we look around the country, the fatalities that we're seeing are in large measure those that are vulnerable. And if you look at Seattle, you see what happens if we don't take these steps to restrict visitation. Again, I understand there are going to be Kentuckians that aren't going to be able to potentially see mom or dad and want to go there and want to check to make sure they're getting the best care. I understand that. But we are working to protect the lives of those same loved ones. And so what I'd encourage people is work with us. If you have questions, call the Inspector General's office. That number again is 502-564-2888. I hope people know that I am a family guy. It is one of the most important things to me in the world. So I understand the gravity of this step, but it is necessary to prevent harm to our seniors.
Governor, the 3 Harrison County cases you said were related?
Right now, we can't disclose more information, but all 3 individuals are closely linked.
But you said yesterday one from Harrison County was a Walmart employee, I believe.
That is correct, but none of the links are based on Walmart. Again, people should not be scared or nervous to go to a Walmart or to go to the Cynthiana Walmart. Steps have been taken, cleaning's been done, and let me say that we have Mayor Gordon here today from Lexington. We are working very well with Fayette County. She and her local health department are doing a great job. The officials in Harrison County have gone above and beyond. They have set a great example of how to communicate and keep calm in a rural county that has already seen 3 confirmed cases. They're a good example that we will get through this, but how important the coordination is with local leadership.
Can you say if the Harrison County cases is a family?
We can at this time.
Talk about the executive order regarding prescriptions. Go through that again. How does that work?
So the executive order on prescriptions allows a pharmacist to refill up to a 30-day supply of non-controlled medication for residents of any Kentucky county. This is especially important for those in self-isolation, or those that might be in one of these long-term facilities that hopefully can get that medication where they are, but if they would have to otherwise go out and see a doctor, this allows the pharmacy to go ahead and provide that. When we look at visitation restrictions, when we look at self-isolation for about 14 days, this is going to make sure that people have the medication that they need. It also allows groups to temporarily operate a pharmacy in an area not designated on their pharmacy permit. And that means that if we need to, in the future, set up any staging areas, that we can again get people the life-saving medication or the medication that helps them live their daily lives that they need. And let's remember that just because we have the coronavirus doesn't mean everything else isn't out there. As we know, the flu is still out there. We're going up on seasonal allergy season where people are going to be coughing because of allergies. And it's important that we make sure people get the medication to continue living their lives. And last, it allows a pharmacy to dispense drugs as needed to create COVID-19, the novel coronavirus, according to any protocols established by the CDC or national groups.
The nursing home restriction, is that executive order as well?
It is not. It is going to be for the facilities that we control. A practice we are going to put directly in place. But let me say it is the strongest guidance. We know through our Department of Public Health that this needs to be done, and we expect facilities to follow it. It is absolutely necessary at this point.
You've used the term restrict visitors. Is there a clear definition for exactly what that means in terms of who can and cannot visit?
Well, that guidance is going to be up on the website later today, but it is strong guidance at this point. We need to make sure that we keep COVID-19, the coronavirus, from getting into these facilities.
Governor, how many people can be tested under current state supplies, and the state looking to expand testing efforts?
Well, our testing right now, I think we've tested on the high end about 13 in a day.
14 or so.
We've tested about 14 or so in a day. We have tested every kit, though, that has come in before noon in that same day. But testing is going to dramatically change once the private labs are up and online. 2 are already doing it. We're pushing for the type of technology. They are cartridges where we could test 1,000 in the amount of time it's taking us to test the 14. We could actually do it much faster. So facts about this virus are going to change potentially dramatically as we learn more. And the testing piece, we keep waiting on what the federal government tells us is imminent when those tests are able to be done. And that just is an example of how guidance from the CDC, how the way we're addressing this is rapidly evolving. It's one of the reasons we're doing this just about every day.
Question for either you, Governor, or Dr. Stack or Mr. Freelander. What is the criteria for testing right now? Will that change? And do you have enough? We have enough tests in the state to do all the testing that needs to be done?
So our testing is based on CDC guidelines and clinician judgment. That means that they are collaborating with our Department of Health to ensure that those who within that judgment and within that guidance need a test, get a test. Obviously, until the commercial labs get up, there are limited numbers, or maybe I should say it the other way, there aren't unlimited amounts of tests. So our goal is to make sure those that are most vulnerable or those who are showing the most symptoms are able to get that test. Again, we're dealing with something that for about 80% of people are going to have mild to no symptoms, but making sure especially those that need help get those tests.
Do we have enough tests?
We have had enough tests for everyone that a test has been recommended for thus far. But again, those numbers are going to just dramatically change once private insurance and those labs come up. We may go from 14 tests a day to hundreds of tests a day as it is more readily available. Joe?
Are the Lexington cases linked, and is there any linkage between the Harrison County, Louisville, and Lexington cases?
We don't have information on linkages in Lexington and Fayette County either way at this time. And right now, we have no reason to believe that there is a linkage between the different county cases. Again, we believe this is communally spread at this point.
Do we know how many people are right now being asked to monitor their own safety who have not been tested yet, or how many people have been tested and have been, come out negative?
Well, I believe we have over 200 people that have been asked to self-isolate. A lot of times those people aren't showing symptoms at all. Anybody that hasn't been tested is very low risk according to the guidelines that we have right now.
Those that are in isolation, all in a hospital facility?
They are a mix between home and hospital isolation. All are receiving medical care. We are comfortable with the self-isolation or the isolation of each of the 6.
Are we concerned, Dr. Freelander, that one of the 6 current patients is in a condition that it is a serious condition or a critical condition? Or they maybe meet some of the guidelines for people who are most at risk with respiratory issues or?
We can't disclose underlying health conditions under HIPAA for any of these different individuals. Those are just privacy laws that are out there. I can tell you with the first patient, they are improving. And at this time, we certainly hope that we will have a recovery for each of the individuals.
Can I ask you maybe a little differently? Have we seen any extreme case of coronavirus in the 6 cases we have so far?
Well, I mean, let me turn that over, I guess, to Dr. Stack. The definition there would be challenging. It affects your respiratory system. It can cause pneumonia. So a lot of it can be how bad that pneumonia gets. That can be impacted by underlying health conditions. But this is something we're still learning about that ranges from no symptoms, it appears in children, to potentially significant ramifications, especially with our seniors or our vulnerable, which again, right now we believe are folks with heart, lung, and kidney disease, and those that may have compromised immune systems.
I think the easiest way to answer that would say that in our 6 positive patients, they have spanned everything from mild illness to severe illness. But even for the patient who is probably the most severely ill, they're improving. And so right now, that's all good. So all the patients are doing well at this time and making positive improvement.
You recommend flu shots still?
Yes.
Recommending pneumonia?
Let me ask Dr. Stack about that.
Yes, if you are above a certain age, and you've got me, I can't quote that age right now, but yes, if your physician, nurse practitioner, or primary care provider recommends the pneumococcal vaccination, which is the pneumonia vaccine, yes, please get that, because it is definitely shown to be helpful for certain populations. So yes, but that's not the same as the influenza shot. If you get the pneumonia shot, you don't have to do it every year. You do it and you're good for a period of time. So yes.
And thank you, Jack, for reminding me. Everybody, get your flu shot. Absolutely get your flu shot. While it will not protect you from the coronavirus, it will protect you from the flu, which at this time is much more widespread and is much deadlier. This ought to be a good reason, with all of the information that is out there on coronavirus, to know you need to get your flu shot. The objections that out there aren't based on scientific fact. Protect your kids, protect yourself, protect your families. Let me tell you that this governor's absolute recommendation is get that flu shot.
Governor, yesterday you said you couldn't say whether or not the person who was in Fayette, there was one person in Fayette County, you couldn't say whether or not they were actually a resident of Fayette County. Do we know that information?
We don't have that information at this time. My hope is that we will have it by the end of the day or tomorrow at the latest.
With more cases expected, it looks like more people have to go into self-isolation, quarantine. Do the guidelines, are they on the website?
Yes.
Families should do?
Yes, there is guidelines on the website about how to care for someone that is in isolation. Talks about how you ought to set up the house and then how you ought to provide that care. Please go to the website. There are guidelines on there just generally of what we should be doing. And at this point, I believe that we should be doing we should all be doing some of the social distancing. We ought to be washing our hands. Again, those over 60 or who are vulnerable ought to be avoiding crowds. There is also guidance for counties where we have had a confirmed case, and then there is even separate guidance for caregivers or those that are caring for someone in isolation.
There were some reports yesterday that one of the cases was a Walmart worker who worked in a bakery. Is there any confirmation of that? And if one of these cases, or if a case is involved in the food service industry, does that complicate trying to figure out if there would be any spread?
As of this time, though, all of the coworkers that we have identified and talked to from that facility are not showing symptoms. At the moment, we don't have a reason to believe that it would have been spread from the facility, other than how things could be normally communally spread.
Did this person work in the bakery?
We can't provide more details at this time than they were a worker at that Walmart.
Can you see how the healthcare providers that last Friday were put in quarantine, how they're doing?
Do we have an update on that?
So to my best knowledge, the healthcare workers are all well, and they are being monitored, the ones who are exposed. And I will say, just on the testing piece, if you don't have symptoms right now, it's not recommended to get the test, because a negative test doesn't guarantee you don't have the condition. So just to help with confusion, we want everybody to get the test who wants to get the test, for whom there's a good reason to get it. But like any resource we use in healthcare, using the test at the right time so the information it produces is helpful is really important for any condition. So for people who don't have symptoms, getting a negative test is not necessarily helpful. So, but all those healthcare workers of whom we're aware are currently doing well, but they're being monitored, and should that condition change, obviously we'll be there to help them and advise.
The first person diagnosed in Harrison County, which of the three people, the demographics was that? You said 27-year-old female.
It's a 27-year-old. Of course, that doesn't mean that they are the first person who had the virus. It's the way that it manifests. That's going to be impossible, I believe, for us to determine.
Yesterday, I think you said 6 of the coworkers were on isolation. That number still the same?
We'll have to check on that for you. WEDCO, the local health department there, is doing a good job working directly with that facility and with the workers. All right.
Thank you.
Thank you all very much.
Hi, thank you.